Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
Doing well. Thanks for having me, Jared.
Absolutely. I'm excited. As we were discussing a little bit before the podcast, you're in a space that I really love. It's near and dear to my heart. So it was really cool to learn about your company, and I'm excited to learn more about you as well. I think we should dive right into it. If you could tell the audience a little bit about yourself, then we'll go into talking about direct shifts.
Absolutely. So, quick background. I actually did not have any healthcare experience previously. I actually have a PhD in aerospace engineering and an MBA from, I went to school at Georgia Tech. But then started from there, got involved in a lot of technology. Did my first technology tech startup in 2011, partnered up with another friend of mine who was a computer scientist at Georgia Tech. And, we went through a company focusing on data security for files on Google Drive, Dropbox, etc. Went through Y Combinator, startup accelerator, raised a bunch of money from investors in San Francisco, and then merged that with another company. Have been in the healthcare space, in the technology space. And then my wife, she's a physician. My sister is a physician. I come from a family of physicians, I think, and just working, just being surrounded by them and just listening to the phone calls that's coming in and hearing a lot of their problems. I definitely recognize that, one thing as young clinicians, they wanted to move more and more towards freelancing. And, they were seeing hearing them speak about some of the pains about finding a job opportunity in the healthcare space seemed very cumbersome. So given my experience with technology, I think one of the things which I wanted to really bring to the healthcare system was how can we really redefine the recruitment space using technology, make it much more convenient and effective, and as well as decrease the recruitment costs, decrease the administrative time and efforts required on both parties, be it clinicians or employers. Given that we're in a pandemic, I think we can all recognize how big administrative costs are to health systems. So that's kind of how DirectShifts originated, and that's kind of how we got started off.
Interesting. Yeah, it's that's honestly my favorite part is hearing how things started, what led you to that. And, more often than not, it has to do with family members, friends, people that are surrounding you, and you're kind of hearing their problems. And I think anyone who's very entrepreneurial, right, is going to pick up on that and want to start a business based on these pains they're hearing all around them. Because what I found, people very rarely complain about certain things related to work unless it really is bothering them in some capacity. So really cool. Can you tell us more about which professional types you focus on with DirectShifts and kind of how the whole process works, if that's okay?
So, initially we started off, so I'll just quickly tell you, at DirectShifts, what we do is we connect clinicians to employers for short-term as well as full-time opportunities. Clinicians can sign up through our portal. They can specify what kind of opportunities, what locations, set up their preferences, be it they want to practice in an outpatient setting, an inpatient setting, a telemedicine, urgent care, in person or remote, what kind of a setting they want to work in. And then employers on the other side, they also can sign up with us. They can specify what kind of clinicians they're looking for. And then we do the matching. And we follow up with any applications, anything of that sort, getting them credentialed, and then finally getting them to work. So that's kind of what we do at DirectShifts. And we started off with physicians because, like you said, my family's, come from a family of physicians. We started off with physicians. Started off with working, solving their problems, and then, their friends, and that's kind of how the network started off. But very quickly, from the employer side, we just found demand not just for physicians, but also for advanced practitioners, be it nurse practitioners, physician assistants, CRNAs, nurse midwives, And then, it eventually led to nursing, allied health workers, medical assistants as well. So until almost, last year, we were purely focused on physicians. But during this pandemic, and then, slightly earlier than the pandemic, we got a lot of demand for the other professions. So we very quickly expanded our platform to all healthcare professions now. And we basically service any healthcare profession that's available. Saying that, definitely I think majority of the business still is in physicians and advanced practitioners, but the allied health sector also is growing very quickly from our side.
Perfect. Yeah, no, I think you're in a great space. I did like hearing that you're working with these advanced practitioners too. I think they are often an overlooked specialty type, and their role in healthcare is so huge, right? So just like physicians, they play a huge role in our health system today. So do the advanced practitioners. And I feel like a lot of organizations seem to overlook that specialty. At least a lot of the advanced practitioners I speak with do have that chip on their shoulder, right? So I'm sure they're super excited to be able to interact with a platform like yours that takes them into consideration.
Yeah, absolutely. In fact, it's almost April, May, June, when New York was going through its peak of its pandemic. Advanced practitioners was a heavy focus for us. A lot of health systems were requiring advanced practitioners. So, that's kind of like, I would say 80 to 90% of our business was focused on advanced practitioners. So, we love working with them.
Perfect. Where can people learn more about you and your organization?
Yeah. So the easiest thing, is our website. I think part of the mission is what we started off is that we want to be as transparent as possible to clinicians and employers, make it much more transparent process. Previously a healthcare company or a healthcare recruitment company, even now, a lot of companies, you would find bare basic minimum information about them on the website, what kind of opportunities, etc. We want to completely, sorry, we completely remove that process and make it extremely transparent to both parties, be it about us, about any given position, anything like that sort, can be found on our website. So, we encourage all our clinicians to go online on our website. They can find information about us. We're also very active on social media through our marketing team. We're active on LinkedIn, on Twitter. We're active there. And previously, again, pre-COVID, I think, we're also very active in like conferences and meetups where we would go and engage with clinicians or employers. That's turning into more remote now, of course, given the pandemic, but we're still pretty active there. So 3 different ways where people can find us and interact with us.
Yeah, I think I saw a recent post of your organization, I think at a past event, where it was like your stand and everything.
Yeah.
And it was definitely bringing back some memories, right, of when we actually had those type of events. They seem forever ago. I think pretty much for this whole year, right? We've kind of been out of the conference game, so to speak. Hopefully things get better so we can start things up next year. I know I'm really looking forward to the in-person, like HLTH, the whatever health conference.
Yes.
Out in Boston next year, because I'm out in Boston. So I'm hoping at least by next October we're having some events, but I hope even before that we're able to safely go to events and be able to network. I do like the virtual events, but they're not the same.
Yes.
They are not the same.
Absolutely.
Great. Well, hey, I'm really happy that you were able to come on the podcast, share more about yourself and DirectShifts. I'll throw a couple links to the website and your social channels so people can follow you and take a look at that and learn more. But thanks again for being a guest.
Awesome. Thanks, Jared. Thanks for what you're putting it out there. So appreciate you having me on the podcast.
Absolutely. No worries.